For the last 10 years, Safaricom Foundation has partnered with the Kenya Diabetes Management and Information Center to offer free medical services to communities across the country. Through these medical camps and various other health interventions, for example, equipping of health facilities, we've reached over 1 million people with specialized health services, reaching far-flung communities in places such as Turkana, Garissa, and Baringo, as already been said. We have so far done 5 phases of these medical camps, and each phase consists of 16 free medical camps and lasts about 2 years. For those of us who go to these camps, it's really amazing that as early as 4 a.m., people are already seated in their queuing, and they continue to wait in the sun up to 4 or 5 o'clock in the evening, waiting for that medical care. And when they do get that, and they have the medicine in their hands, you can see the sense of pride and the sense of hope that eventually something is going to happen to them that will bring a difference in their health. And we're driven by the fact that for too many Kenyans, these camps form the only connection they have to any kind of health care. I would like to share the story of a 70-year-old woman. I think that has already been shared, you know? It's really, really amazing that she had cataracts. She couldn't do anything on her own. She navigated her way through the house using a string. I don't know how you do that. You navigate your way in your house through using a string. So coming to the camp gave her access to healthcare consultants who then advised that she has surgery, and with the end result that she can now see. 3-year-old girl in Naivasha, who also having had access to our camps, her problem was identified. She had what is called a rectal prolapse, which meant that she could not play like other children of her age, and also meant that her mother could not make a living, as she was expected to look after her constantly and on a daily basis. So today the young girl has recovered fully following 2 surgeries, and her mom can now take on work to ensure that they both have essentials in their home. Kenya's Vision 2030 aims to provide an efficient, integrated, and high-quality, affordable healthcare to all citizens, with priority given to preventive care at community and household levels. It is for this reason that we aim to support the government's agenda of promoting healthcare in Kenya. During the medical camps, we not only screen for non-communicable diseases, but also carry out awareness campaigns. What we've seen is that for maximum impact, there is need to train professional healthcare workers as well as community health workers to reduce the impact of non-communicable diseases and public health issues at community levels. In conclusion, ladies and gentlemen, we are pleased to announce an increased funding of Shillings 36 million, which will go towards phase 6 of the free medical camps program.
When we go out there in the outreach, in the communities, we see what we are able to do in the medical camps. We have people who are sensitized on their conditions. We have conditions that are picked up, that have been for long not attended to, and these people are able to get assistance. We have cases that cannot even be treated on the ground. And these cases, the foundation is able to assist these cases so that these people have a new lease of life. And these are some of the beneficiaries that we have today. We have seen people who have no idea about their condition. They do not know they have diabetes. They do not know they have blood pressure. We do the cancers, we do the eyes, and in the last phase, we were able to also start doing surgeries for the patients who have cataracts. We actually added the numbers. They were still there. Now we're able to do up to 60 cases who have been picked up in these camps in the community. We're also able in phase 5 to do not just removing the teeth. not just checking the teeth and removing those that are bad. We had facility for 40 patients would benefit from, in every camp, would benefit from filling of their teeth. And we thank all those people who have been with us. We have other volunteers who work with us in this very, very impactful project.